Hello, I'm Kaylee.
Hi Kaylee, I'm Dr. Allie. Nice to meet you.
Nice to meet you too. So you are currently a naturopath at Reflective Soul Therapy and Wellness. I'd love to know about what naturopathic medicine means to you.
So naturopathic medicine means to me taking a thoughtful and evidence-based approach to understanding someone's health and why they might be struggling with their health. I like to fill in the gaps left by other professions, and I like to take a more, while we do look at each individual symptom and trying to repair where we can, taking a more broad perspective at what the patient's going through to see if we could find sometimes a root cause, or sometimes just figuring out where the pieces connect so that we can fix all of the problems and not just a couple.
What can somebody expect from their first visit with you?
The first visit is all about collecting information. So when we get together, we typically start the first appointment with an hour and a half-ish discussion on what the patient is experiencing, like what symptoms they're having, how they got to this point, what symptoms they've been experiencing all through their life, previous diagnoses. We talk about as many details as we can so that I can better figure out what's going on with their health and how to help them go forward. Sometimes in a first appointment we will run blood work, but often that comes as part of the treatment plan and it's a discussion back and forth. I don't pressure people into doing unnecessary labs, so it is something that I want my patients to feel comfortable doing when they do it. And every appointment, your first appointment comes with a treatment plan most of the time. There are occasions where we have to dive a little bit deeper into assessment to figure out what's going on. But for the most part, after one appointment, we can usually get an idea of where we should be moving forward.
Okay, sounds like you go really in depth with it.
Mm-hmm. In depth is my whole shtick.
Here at Reflective Soul Therapy and Wellness, you're working alongside a multidisciplinary team. How do you work with the counselors and what do you enjoy about it?
What I enjoy about the counselors is they do complement my treatment plans fairly well. They do the talking side of things. I mean, I talk with my patients as well, but the counselors will provide tools, tools for them to get through their everyday and life skills that the physical side of things maybe doesn't address. Whereas I will come in with more of the physical side of things, and I might be prescribing supplements or herbal medicines, lifestyle options, or sometimes medication when necessary. So we can handle the more physical side of things, but I want them to have somebody that they can, hash out all the details about what's going on in their lives and help them figure out things in that sense. A lot of stress and anxiety is situational. So I think that extra professional side of things can be quite helpful.
What is one small daily practice that people can do that will make an impact on their health?
It's a big practice, but it's eating enough fruits and vegetables. So few people are focusing on the fiber side of things right now. People tend to be very focused on high protein diets. And while protein is great, neglecting how much fiber is in your diet can be pretty detrimental long term. Having enough fruits and vegetables in your diet can improve your, it'll decrease your risk of cardiovascular events, it'll decrease your risk of developing cancer, improve your digestive health. It's quite important, but very overlooked.
Okay. Tell me about the modalities of your profession.
I practice a number of modalities. The most obvious ones would be herbal medicine and supplementation. I fell in love with herbal medicine a long time ago. And then my first degree was in biological sciences. So as time went on, we had the historical herbal medicines, and then now we have the studies that go with the historical herbal medicines that either confirm or completely refute what we thought about things before. So I like how that is all kind of coming together, and it makes it a little bit easier for us to treat our patients if we can, we know what to expect using the more traditional options. and we can completely get rid of some that don't work. So herbs and supplements. In addition to that, I do practice acupuncture in more of a medical physiological type of way than a TCM type practice. I find that acupuncture is quite helpful for a lot of my patients for neurological and pain-related disorders. I find nutrition is a very, very powerful modality. I have a lot of nutritional background. Even before I went to naturopathic medical school, I did a lot of the nutrition courses in undergrad, especially the higher level ones. So I had a very good understanding before I even got to that point. And I do stay fairly up to date on nutrition research. And there's so much misinformation out there about nutrition currently. So I really help my patients navigate those pitfalls. And then when necessary, there's also medications. I can prescribe medications currently when we need to and when it's in the best interest of the patient.
How can people book with you?
People can book with me on the Reflective Soul website, or they could give a call into the clinic.
All right. So I'd love to learn a little bit more about you. What's something you do outside of work that brings you joy or helps you recharge?
So I'm quite into gardening. I have a vegetable garden and I have like multiple fruit trees and vines. And so I love to grow things in both outside and inside. I usually fill my spaces with plants. My husband told me I'm not allowed to bring any more plants home, but I still find a way. I can propagate a lot of plants. We might start having to give them away here. But so I love to grow things, and I like to go for hikes with my boys.
All right. Well, it was really nice meeting you here today, and thank you for having this talk with me.
Oh, thank you for having me.